Question 1. According to federal law, how often must a pharmacy complete a complete inventory of controlled substances? A. Annually. B. Every 2 years. C. Every 3 years. D. Biennially. Answer: D. Biennially. This question tests your knowledge of federal pharmacy law regarding controlled substances inventory. The key phrase here is how often for the complete inventory of these specific medications, which are highly regulated by the DEA. Federal law mandates that a complete inventory of all controlled substances in the pharmacy's possession must be conducted at least every 2 years, which is the definition of biennially. This regular count helps prevent diversion and maintain accurate records, ensuring accountability for these potent medications. Remembering biennially directly links to the 2-year federal requirement for controlled substance inventories. Question 2. A prescription calls for amoxicillin 250 mg per 5 milliliters. The patient needs 250 mg 3 times a day for 10 days. How many ml of suspension should be dispensed? A. 50 milliliters. B. 150 milliliters. C. 250 milliliters. D. 300 milliliters. Answer: B. 150 milliliters. This is a dosage calculation problem testing your ability to determine the total volume needed for a liquid medication. The prescription specifies a concentration of 250 mg per 5 milliliters and requires 250 mg per dose, meaning each dose is 5 milliliters. The patient takes this dose 3 times daily for 10 days, totaling 30 doses. To find the total volume, you multiply the volume per dose, 5 milliliters, by the total number of doses, 30, resulting in 150 milliliters. Always calculate the total number of doses first when determining the total quantity needed. Question 3. Which of the following drugs is commonly used to treat hypertension? A. Omeprazole. B. Metformin. C. Lisinopril. D. Sertraline. Answer: C. Lisinopril. This question assesses your knowledge of common medications and their primary uses, specifically focusing on a condition like hypertension, high blood pressure. Lisinopril is an ACE inhibitor, a class of drugs widely prescribed to lower blood pressure by relaxing blood vessels. Omeprazole treats acid reflux, metformin treats diabetes, and sertraline treats depression. Knowing the main indications for commonly prescribed drugs is crucial for a pharmacy technician. Question 4. A patient brings in a prescription for ibuprofen 600 mg, number 30, take 1 tablet by mouth 3 times daily as needed for pain. What is the maximum number of days this prescription can last if the patient takes it as directed? A. 10 days. B. 30 days. C. 15 days. D. 5 days. Answer: A. 10 days. This question involves calculating the day's supply for a medication taken as needed but with a maximum frequency. The patient takes 1 tablet up to 3 times daily. To find the maximum duration, you calculate how many days the total quantity, number 30 tablets, would last if taken at the maximum frequency, 3 tablets per day. Dividing the total quantity, 30, by the daily dose, 3, gives you 10 days. Even though it's as needed, the maximum daily dose is used for calculating the longest possible duration the dispensed quantity will last. Question 5. Which federal law requires pharmacies to have patients sign a logbook when purchasing certain over-the-counter medications containing ephedrine, pseudoephedrine, or phenylpropanolamine? A. HIPAA. B. PPPA. C. Combat Methamphetamine Epidemic Act, CMEA. D. OBRA 90. Answer C. Combat Methamphetamine Epidemic Act, CMEA. This question tests your understanding of specific federal laws impacting pharmacy operations. The key elements are logbook, over-the-counter medications, and the specific ingredients like pseudoephedrine, which are precursors for methamphetamine production. The Combat Methamphetamine Epidemic Act of 2005 enacted regulations to control the sale of these products to curb illegal methamphetamine production. HIPAA protects patient privacy, PPPA involves child-resistant packaging, and OBRA 90 mandates drug utilization review and patient counseling for Medicaid patients. Question 6. What is the primary purpose of a tallman lettering system in a pharmacy? A. To store medications requiring refrigeration. B. To highlight lookalike/soundalike medications. C. To indicate medications that are controlled substances. D. To label medications that are expired. Answer B. To highlight lookalike/soundalike medications. This question focuses on quality assurance and error prevention strategies in the pharmacy. The term tallman lettering refers to capitalizing specific letters within drug names, e.g., hydroxyzine versus hydralazine, to visually distinguish between medications that look or sound similar. This system is a critical safety measure designed to reduce the risk of medication errors caused by confusing similar-sounding or similar-looking drug names. It's a simple but effective way to draw attention to potential mix-ups on pharmacy shelves or computer screens. Question 7. A hospital pharmacy needs to prepare a 500 ml bag of D5W with 20 milliequivalent of KCl. The available stock is KCl 2 milliequivalent/ml in a 10 ml vial. How many ml of the KCl solution are needed? A. 5 milliliters. B. 10 milliliters. C. 20 milliliters. D. 40 milliliters. Answer B. 10 milliliters. This is a simple calculation for preparing an 4 admixture, requiring you to determine the volume of a stock solution needed to achieve a desired dose. You need a total of 20 milliequivalent of KCl. The available stock solution has a concentration of 2 milliequivalent per 1 milliliter. To find the volume needed, you divide the desired dose, 20 milliequivalent, by the concentration, 2 milliequivalent/ml, which equals 10 milliliters. This means you will draw up 10 milliliters of the KCl stock solution to add to the 4 bag. Question 8. Which of the following medications is an anticoagulant, often referred to as a blood thinner? A. Atorvastatin. B. Warfarin. C. Amlodipine. D. Gabapentin. Answer B. Warfarin. This question tests your knowledge of common drug classes and their therapeutic uses, specifically identifying a medication used to prevent blood clots. Warfarin is a well-known oral anticoagulant that interferes with blood clotting factors. Atorvastatin is a cholesterol-lowering drug, amlodipine treats high blood pressure, and gabapentin is used for nerve pain and seizures. Recognizing common drug classifications helps you quickly identify a drug's general purpose. Question 9. According to the Poison Prevention Packaging Act, PPPA, most prescription drugs must be dispensed in containers that are A. Tamper-evident. B. Child-resistant. C. Light-resistant. D. Moisture-resistant. Answer B. Child-resistant. This question directly tests your understanding of the Poison Prevention Packaging Act, PPPA. The primary goal of the PPPA is to protect children from accidental poisoning from potentially harmful substances, including medications. Therefore, the Act mandates that most prescription drugs, as well as many over-the-counter products, be dispensed in special packaging that is significantly difficult for young children to open. While other types of packaging are important for drug stability, child-resistant packaging is the specific requirement of the PPPA. Question 10. If a patient's prescription has the SIG code 2GTTSOU daily, what does this mean? A. 2 drops in the left eye daily. B. 2 drops in the right eye daily. C. 2 drops in both eyes daily. D. 2 drops under the tongue daily. Answer: C. 2 drops in both eyes daily. This question tests your ability to interpret common prescription abbreviations or SIG codes, specifically for ophthalmic, eye, medications. The abbreviation GTTS stands for drops. OU is a medical abbreviation derived from Latin meaning oculus uterque, which translates to both eyes. Therefore, 2 GTTSOU daily means to administer 2 drops into both eyes once a day. Understanding these standard abbreviations is vital for accurately filling prescriptions. Question 11. Which organization is responsible for setting standards for sterile compounding to ensure patient safety? A. DEA. B. FDA. C. ASHP. D. USP. Answer: D. USP. This question asks about the organization that establishes standards for sterile compounding practices in pharmacy. The United States Pharmacopoeia, USP, sets official public standards for quality, strength, purity, and consistency of medicines, including specific chapters dedicated to sterile compounding, such as USP less than 797. The DEA regulates controlled substances, the FDA approves and regulates drugs, and ASHP is a professional organization for hospital pharmacists but does not set mandatory legal standards. USP standards, particularly USP less than 797, are critical guidelines for preparing sterile products safely. Question 12. A prescription for Augmentin, amoxicillin/clavulanate, 875 mg number 20, take 1 tablet by mouth every 12 hours. When calculating the day's supply, what is the correct duration this prescription will last? A. 5 days. B. 10 days. C. 20 days. D. 40 days. Answer: B. 10 days. This is a day's supply calculation for a medication taken at a fixed interval. The prescription provides 20 tablets. The dosing instruction is 1 tablet every 12 hours, which means the patient takes 2 tablets per day, 1 in the morning and 1 in the evening. To find the day's supply, you divide the total quantity dispensed, 20 tablets, by the number of tablets taken per day, 2 tablets/day, resulting in 10 days. Calculating the daily dose based on the interval is the first step in determining the day's supply. Question 13. Which of the following is not a required component of a prescription label in most states? A. Patient's phone number. B. Pharmacy name and address. C. Prescription serial number. D. Drug name, strength, and quantity. Answer: A. Patient's phone number. This question tests your knowledge of mandatory information that must appear on a prescription label. While having a patient's phone number is important for pharmacy records and communication, it is generally not a federally or state-mandated element that must be printed on the prescription label itself. Required information typically includes the pharmacy details, prescription identifier, patient's name, drug information, prescriber's name, fill date, and directions for use. Focus on the key pieces of information needed for the patient to safely and correctly take their medication. Question 14. A medication order reads, acetaminophen 650 mg POQ4 HPRN pain. What does PO mean? A. By injection. B. By mouth. C. rectally. D. As needed. Answer B. By mouth. This question assesses your understanding of common medical abbreviations used in medication orders and prescriptions. PO is a standard abbreviation originating from the Latin phrase per os, meaning by mouth. Therefore, the instruction acetaminophen 650 mg PO indicates that the medication should be taken orally. Recognizing common routes of administration like PO is fundamental to interpreting medication orders correctly. Question 15. What is the maximum number of refills allowed on a prescription for a Schedule IV controlled substance? A. 0 refills. B. 1 refill. C. 5 refills within 6 months. D. As authorized by the prescriber within 1 year. Answer C. 5 refills within 6 months. This question tests your knowledge of federal regulations regarding refills for controlled substances, specifically Schedule IV drugs. According to federal law, prescriptions for Schedule III and Schedule IV controlled substances are permitted to be refilled up to 5 times within 6 months after the date of issue. Schedule II drugs cannot be refilled, and Schedule V drugs typically have no federal limits on refills, though state laws may vary. Remember the 5 and 6 rule for Schedule III and IV medications. Question 16. A patient needs to take 5 milliliters of a liquid medication. How many teaspoons is this equivalent to? A. 0.5 teaspoons. B. 1 teaspoon. C. 2 teaspoons. D. 5 teaspoons. Answer B. 1 teaspoon. This is a basic conversion question, requiring you to know common household measurement equivalents used in pharmacy. There is a standard conversion between milliliters, ml, and teaspoons. 1 teaspoon is equivalent to approximately 5 milliliters. Therefore, 5 milliliters of liquid medication is equal to 1 teaspoon. Knowing simple conversions like this helps patients accurately measure their liquid doses at home. Question 17. Which of the following is a critical step in the pharmacy workflow to prevent dispensing errors? A. Counting the medication twice. B. Verifying the patient's identity before dispensing. C. Storing all medications alphabetically. D. Checking the prescription against the insurance card. Answer B. Verifying the patient's identity before dispensing. This question focuses on quality assurance and patient safety within the pharmacy workflow. While counting accurately is important, verifying the patient's identity before handing over the medication is a crucial final check to ensure the right drug goes to the right person. This step helps prevent dispensing errors like giving medication to the wrong patient, a potentially serious mistake. Storing alphabetically is helpful but not a critical error prevention step itself, and checking insurance is administrative, not a direct safety check before dispensing. Always confirm the patient's identity when delivering medication. Question 18. The generic name for Lipitor is A. Simvastatin. B. Atorvastatin. C. Rosuvastatin. D. Pravastatin. Answer B. Atorvastatin. This question tests your knowledge of common brand name and generic name drug pairs, a fundamental part of pharmacy technician training. Lipitor is a very widely prescribed medication used to lower cholesterol. Its generic name is atorvastatin. Knowing the generic equivalents for popular brand name drugs is essential for accurate dispensing and understanding patient profiles. Question 19. Which document must a patient sign to acknowledge that they have been informed about how their protected health information, PHI, will be used and disclosed by the pharmacy? A. Prescription hard copy. B. Medication guide. C. Notice of privacy practices. D. Patient profile consent. Answer: C. Notice of privacy practices. This question relates to HIPAA and patient privacy. HIPAA requires healthcare providers, including pharmacies, to provide patients with a Notice of Privacy Practices, NPP. This document explains how the pharmacy may use and disclose the patient's protected health information, PHI, and outlines the patient's rights regarding their information. While patients often sign an acknowledgement that they received this notice, the notice itself is the document detailing the privacy practices. Question 20. A prescription is written for Lantus Solo Star Pen, inject 20 units subcutaneously daily. What is the route of administration? A. PO. B. 4. C. IM. D. Sub-Q. Answer: D. Sub-Q. This question asks about the route of administration for a specific medication, Lantus, which is insulin administered via a pen device. The instruction subcutaneously indicates the route. Subcutaneous injection, sub-Q, means injecting the medication into the fatty tissue just under the skin, which is the standard method for administering insulin. PO is by mouth, 4 is intravenous, into a vein, and IM is intramuscular, into a muscle. Recognizing common routes of administration like sub-Q is important for understanding how a patient will take their medication. Question 21. What does the abbreviation NPO mean in a patient's chart or medication order? A. New patient order. B. Nothing by mouth. C. Needs prescription authorization. D. Nurse practitioner order. Answer: B. Nothing by mouth. This question tests your understanding of common medical abbreviations related to patient status or orders, specifically NPO. NPO comes from the Latin phrase nil per os, meaning nothing by mouth. This order is often given before surgery or certain medical procedures to prevent aspiration. Understanding this abbreviation is crucial in a hospital or clinical pharmacy setting to ensure no oral medications or food are given to the patient. Question 22. A patient is prescribed metformin. Which of the following conditions is metformin typically used to treat? A. Hypertension. B. Depression. C. Type 2 diabetes mellitus. D. High cholesterol. Answer: C. Type 2 diabetes mellitus. This question assesses your knowledge of common drugs and their primary indications, focusing on metformin. Metformin is a first-line medication widely used to manage blood sugar levels in patients with type 2 diabetes mellitus. It works by reducing glucose production in the liver and improving insulin sensitivity. Hypertension is treated with blood pressure medications, depression with antidepressants, and high cholesterol with statins or other lipid-lowering drugs. Question 23. How many milligrams, mg, are in 2 grams, g? A. 0.002 milligrams. B. 20 milligrams. C. 200 milligrams. D. 2,000 milligrams. Answer: D. 2,000 milligrams. This is a basic unit conversion problem within the metric system, a fundamental skill for pharmacy technicians. The relationship between grams and milligrams is based on powers of 1,000. 1 gram is equal to 1,000 milligrams. Therefore, to convert 2 grams to milligrams, you multiply 2 by 1,000, which equals 2,000 milligrams. Remembering that there are 1,000 milligrams in 1 gram is key to solving these conversions. Question 24. According to federal law, how long must prescription records be kept by a pharmacy after the date of filling? A. 1 year. B. 2 years. C. 5 years. D. 7 years. Answer B. 2 years. This question tests your knowledge of federal record-keeping requirements for prescription records. While state laws may require longer periods, federal law, specifically through the DEA for controlled substances and generally for other prescriptions, mandates that prescription records must be maintained for a minimum of 2 years from the date of filling or the last refill. This requirement ensures that pharmacies can provide records for audits or legal purposes. Question 25. Which term describes the process of comparing a patient's current list of medications against the medications ordered by the physician to identify discrepancies? A. Drug Utilization Review, DUR. B. Medication Reconciliation. C. Pharmacy Inventory Management. D. Adverse Event Reporting. Answer B. Medication Reconciliation. This question defines a specific process used in healthcare settings to improve patient safety related to medications. Medication reconciliation is the formal process of creating the most accurate list possible of all medications a patient is taking and comparing it against the physician's admission, transfer, or discharge orders. This helps identify and resolve discrepancies such as omissions, duplications, dosing errors, or drug interactions. DUR is a broader review of prescription appropriateness, inventory management is about stock, and adverse event reporting is about side effects. Medication reconciliation is specifically about comparing lists to ensure accuracy during transitions of care.